Neonatal nurses work with newborns with a variety of problems such as congenital defects, prematurity, surgical problems, and other body malformations. The scope of a neonatal nurse ranges from minimal supportive care to highly complex intensive care. Neonatal period is described as the first month of life, but for these newborns, they are usually sick for months.
It takes a special person to become a nurse, but that's even more true for those who become a neonatal intensive care unit nurse. These dedicated professionals care for the most fragile patients. They are sick and premature newborns. In addition, they are on the front lines when it comes to helping scared parents through what is often a traumatic experience. To become a neonatal intensive care nurse, you must first be a registered nurse with either an associate's degree in nursing or a bachelor's of science in nursing. Hospitals hiring for a neonatal intensive care will give priority to RNs who have obtained their bachelor's degree over those with only an associate's degree. Although certification is not always required for RNs to work in a NICU setting, many NICU nurses must meet the requirements of having a minimum number of years of clinical experience in institutional context. Understanding NICU levels. All neonatal care units, known as NICUs, care for babies who need special help, but different NICUs offer different levels of care. Level 1. Basic care. Level 1 NICUs provide care for healthy, full-term babies. They also stabilize near-term babies to get them ready to be moved to specialized facilities. Level 2. Advanced care. Level 2 NICUs offer care for babies born at or after 32 weeks and babies who are recovering from more serious health problems. Level 3. Specialized care. Level 3 NICUs care for very sick babies and offer access to a wide range of pediatric specialists and equipment, such as x-rays and ventilation support. The babies in these nurseries are generally born earlier than 32 weeks or have a critical illness. Level 4. Highest level of care. Level 4 NICUs provide the highest level of neonatal care. They have a full range of healthcare providers, including pediatric subspecialists, specialized nurses, and equipment to care for very sick babies.
Neonatal nurses must be able to use a wide variety of equipment. Equipment can range from simple tools such as needles, stethoscopes, and thermometers to more technologically advanced equipment. Take, for example, the specialized equipment used to assist premature babies who have trouble breathing. Neonatal nurses begin with an endotracheal tube. This tube is placed through the baby's mouth or nose into the trachea. It is held in place with a special tape and connects to a mechanical ventilator. A mechanical ventilator or respirator helps babies who can't breathe on their own or who need help taking bigger breaths. High-frequency ventilators give hundreds of very fast puffs of air to help keep a baby's airways open. They can also provide extra oxygen to the baby. Another helpful piece of equipment is the continuous positive airway pressure machine, or CPAP. This machine pushes a continuous flow of air through small tubes that fit into the baby's nostrils to help keep tiny air passages in the lungs open. CPAP can give extra oxygen as well. One of the most important pieces of equipment a neonatal nurse will have to use is an incubator. An incubator protects a preemie from infection, allergens, or excessive noise or light levels that can cause harm. It can regulate air humidity to maintain the integrity of the skin and even can be equipped with special lights to treat neonatal jaundice, which is common in newborns.
The role of the neonatal nurse is by no means easy. There are indeed some hardships they experience. One of the hardships that neonatal nurses face is the loss of a higher level NICU baby. Not only does the nurse endure the loss, but they are also responsible for providing support for the family who suffer the loss of their baby. While it is difficult to not get attached to the patient and their family, it is important for the neonatal nurse to maintain a professional relationship with them. Another hardship neonatal nurses face is mental health issues, such as depression and anxiety. It is important for the neonatal nurse to understand that not all babies are going to make it. In order to prevent mental health issues, the neonatal nurse must learn coping techniques to help them in these difficult situations. One more hardship neonatal nurses face is alarm fatigue. This is when a nurse becomes desensitized to the beeping of the monitors, vital sign machines, and feeding pumps. Oftentimes, these are false alarms, which can lead a nurse to ignore them. It is imperative for the nurse to be aware of and check on all monitors that go off to ensure appropriate care of the baby.
One might ask, what brings neonatal nurses satisfaction in their job? Neonatal nurses reported that job satisfaction comes through compensation, team spirit among nurses, support from physicians, and advocacy. The compensation is positive patient outcomes. Recently, a young family spent 45 days in the NICU with their baby, who was born 10 weeks early. This mother selected a primary nurse for her son's care, which meant at least 3 out of the 7 days the same nurse was caring for her baby. The family and baby were able to get to know her on a personal level, and she became Titus's #1 advocate. She encouraged Titus to constantly advance. She communicated properly with doctors, NPs, PAs, and other nurses, which kept everyone on the same page. This baby went home after 45 days as a perfectly healthy 36-weeker. This advocating nurse challenged the team to advance the baby. This is a positive outcome which gave the nurse satisfaction as well as the family.